رحمن يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن.
May I have the privilege and honor to call on Dr. Usman Abubakar Adamu, the Incident Manager at the National Primary Healthcare Development Agency, Abuja, to present his talk on the COVID-19 vaccine and Nigeria's response. Dr. Usman, you have the floor.
The chair of the occasion is Royal Highness Shanga, our mentor and our former chairman, the president of this great association, Professor Ibrahim Orekwa. It is indeed an honor. My name is Dr. Usman Adamu. I'm the incident manager of the Polio Emergency Operations Center and also the team lead COVID-19 Command Center in MPSCDA, and also the incident manager of the National Polio Emergency Operations Center. I am making this presentation on behalf of Dr. Faisal Shoaib, who is the ED of MPSCDA. He would have been here, but for exigencies of his duties, he asked me that I should make this presentation on his behalf. سبحانك لا علم لنا إلا ما علمتنا إنك أنت السميع العليم. I seek your intervention to be able to share my screen so that I can go through the presentation on behalf of Dr. Faisal, please. Okay, so thank you very much, Mr. President, for giving us the opportunity to make this presentation. I'm making it on behalf of Dr. Faisal. Let me begin to say that before I make the real subject matter presentation, it is important for us to try to address some questions around the local vaccine production in Nigeria. There has been some questions within the medical community on the issue of why are we not producing our vaccines. Those of us who are clinical pharmacologists, those who are industrial pharmacists would have known that the process initially, way back in the 90s, Nigeria was actually producing some quantities of yellow fever vaccine at the Yaba vaccine production facility, right? But due to equipment became obsolete, and in the quest to actually renew equipment, the facility became dormant. And therefore, presently, the Veterinary Research Institute in Nigeria, VOM, also produces some vaccines, I think, for the veterinary use in some cattle. And so what are we saying? We have local capacity to produce our own vaccines. And very much many people among you should have known that recently the government of Nigeria actually approved some money for the local vaccine production. And there is a committee, biobank committee at the national level appointed, put together by the federal, the Minister of Health, under the chairmanship of the virologist, Professor Tamori. And ED also is a member of that committee. And they have gone far in terms of what needed to be done in order to fast track the issue of local vaccine production. Now, it's made up of so many complex processes and capital intensive with several stages, each step actually requiring specific equipment and skills relevant to each candidate of the vaccines in terms of administrative and finance infrastructure, in terms of human resource management, in terms of technology development and procurement. The stages of discovery takes about 1 to 3 years. Development and testing and clinical trials takes an average of 4 to 7 years, whereas the process of manufacturing itself takes an average of 8 to 10 years. So what we do basically in Nigeria is actually distribution of what others have actually produced. And we're happy that the candidate vaccines are on stream, the Pfizer, AstraZeneca, a host of Sinovac, Sputnik, so many candidates are on stream. And thank God, in accordance with what Allah subhanahu wa ta'ala has told us, that if we are afflicted with calamity, we should always say, Inna lillahi wa inna ilayhi raji'un. definitely we are going to find a reprieve. So traditional vaccine development is a long, complex process, often lasting 10 to 15 years. And the most difficult stage is research and development, as I've mentioned, 6 to 5 years. Preclinical, phase 1, phase 2, phase 3, and then approval stage by the regulatory agencies, and then the push to the market, and then phase 4, which takes about 5 years, to actually ensure implementation. Now, given the COVID pandemic, institutions, commercial developers, and agencies and researchers were working at an unprecedented speed due to the available technology to accelerate the development, review, and recommendation of COVID-19 candidate vaccine within the last 10 to 12 months. So how did researchers create COVID-19 vaccine within the short period of time without compromising safety? Researchers were not starting from the scratch. We need to understand that they learned about SARS-CoV-2, the virus that causes COVID-19. It's a member of the already familiar coronavirus family of viruses. And due to advances in genomic sequencing and global collaboration, researchers successfully uncovered the virus sequence in January of 2020, roughly 10 days after the first reported case of pneumonia in Wuhan, China. And therefore, to accelerate the vaccine development, several steps were actually done in parallel in order to shorten the lifeline. mRNA vaccines that are much faster to produce than the traditional vaccines, while guaranteeing the same safety standards without cutting corners. Therefore, researchers use the existing clinical trial networks, like those that study HIV treatments and vaccines, to begin to quickly conduct COVID-19 vaccine trials in different parts of the world. Another critical piece that we need to understand has been the huge investments in manufacturing. Even before COVID-19 vaccines have actually been proven effective. The United States government and vaccine manufacturers have invested millions of dollars to ensure scale-up of this vaccine production while clinical trials are actually ongoing. So in Nigeria, what do we actually do to ensure that we roll out these vaccines? The Ministry of Health, through the National Primary Healthcare Development Agency, the NCDC, that's Nigeria Centers for Disease Control, NAFDAC, and development partners, is planning to procure and ensure timely vaccination of Nigerians at risk of COVID-19. The main objective of this introduction is actually to slow down and interrupt the transmission of COVID-19 outbreak in every part of the country. So the COVAX Advanced Market Commitment is a facility, financing instrument within the COVAX facility through Gavi. So I was saying the main facility of COVAX Advanced Market Commitment is actually to ensure equitable access, because the market is highly competitive and the rich countries are actually striving to ensure that they buy everything. And therefore, the COVAX facility through Gavi is focusing on securing COVID-19 access for middle-income and low-income countries like Nigeria. For the low and middle-income countries, the COVAX aims to improve access to affordable supply of programmatic supports for procurement and campaigns to Gavi-eligible countries. Therefore, the government of Nigeria has formally communicated its interest to Gavi for participation in the COVAX facility. So Pfizer, Moderna, AstraZeneca, and other viral vector vaccines, there are also other non-COVAX facility vaccines. So the COVID-19 introduction, so what did we do? The NPSC, what was I saying? The COVID-19 introduction TWG has actually been established in the agency to monitor the process of all COVID-19 vaccine introduction activities, a multi-sectorial group. So the technical working group includes stakeholders involved in the COVID-19 response at the Federal Ministry of Health, NCDC, NPSCDA, NAFDAC, and the Nigerian Governors Forum, the Federal Ministry of Finance, Budget and National Planning, Ministry of Information, National Orientation Agency, NTA, civil society organization, professional bodies, and organized private sectors, development partners, and donors. The overall objective is actually to implement a successful introduction of this COVID-19 vaccine as contained in the National COVID-19 Deployment and Vaccination Plan. The technical working group has 4 subgroups: planning on coordination and service delivery, surveillance and macro planning, which I lead. Then there is vaccine safety and cold chain and logistics, and demand generation and risk communication, which actually handles the issue of sensitization with the general public around the safety and efficacy of the vaccine. The TWG is actually chaired by the ED and Chief Executive of MPSCDA, and each of these subgroups are chaired by directors of the agency with the support from development partners. Now, we held our regular COVID-19 vaccine introduction planning meeting with partners, and this is an evidence of what we've been doing on a daily basis to ensure. Now, let me talk about the priority target populations that have been identified and strategies developed to best reach the eligible population with the COVID-19 vaccines. Unusual cohort of eligible persons being targeted for the COVID-19, all age groups. The age group of vaccination is broader compared to most other traditional vaccines that are actually contained in our routine immunization schedule. Multi-sectorial collaboration is actually needed and is actually being applied to ensure we select the appropriate eligible population. So based on this, the guidelines from WHO in accordance with epidemiology of the disease in Nigeria, priority will actually be given to frontline health workers, especially those working in isolation and treatment centers from around the country. And then older age group, above 50 years, are most at risk in Nigeria. Looking at the profile as presented by Dr. Jafia, and other vulnerable individuals with significant comorbidities are actually considered. Additionally, strategic leaders such as Mr. President, the Vice President, Senate, governors, ministers will also be prioritized and vaccinated in a bid to actually boost the shaky public confidence in vaccine safety. So macro planning is about being rolled out to ensure that we verify available information, details obtained from DEX review, or available data from the Federal Ministry of Health and National Population Commission. Therefore, the prioritization of this population is important for us to be able to optimize resources. So we are targeting about 70 million Nigerians for this COVID-19 vaccine in 2021 and 2022 to actually reduce mortality and interrupt COVID-19 transmission in the country. In 2021, we will target 40%, which comes to about 84,655,000. And based on certain assumptions, health workers, support staff, contingency, especially then adults above 50 years, which constitute about 10%, and persons with underlying medical conditions below 50 years, which constitute above 50 years, which constitute about 17%, and then 12% of other risk groups. In 2022, however, we will target 30% of the population, which constitute about 65,035,014. And this comes with the additional other risk group prioritized based on current epidemiology of the COVID in Nigeria. So the total we are targeting is 149,690,763 by 2022. So 20% of the vaccine needs will be covered through the COVAX facility in this year, with the government of Nigeria covering operational costs and extra vaccine needs beyond the 20%. So what does it mean? We will have 20% of what we require fully supported and paid for by Gavi, whereas the operational cost will actually be supported by funding from the government of Nigeria, including the purchase for additional doses of the vaccines to be able to cover additional targets that we plan to cover. Now, the slide details where the health workers and total population targeted for vaccination has been actually mapped out. The map indicates the geospatial distribution of this population. The darker the place, the densely populated the area. You can see Lagos and Kano, the darkest, meaning that the population is actually highest above 100,000, whereas the distribution is now spread across the rest of the states. whereas in terms of the health worker population, then the total population targeted is indicated, is outlined on the map situated on the right, which indicates also population density and the distribution, with Lagos and Kano having the highest numbers of the population in Nigeria. So in 2021, COVID-19 vaccines will be developed, will be deployed in 4 phases based on vaccine type and availability. About 50,000 health workers, frontline health workers, are targeted for immunization with mRNA vaccines, 100,000 doses in Q1 of 2021 in phase 1. So ending February and March, about 100,000 doses expected from the COVAX facility, depending on the quantity. Health workers at isolation and treatment centers, like I said, will be given priority, whereas the remaining health workers at primary health care facilities, hospitals, long-term care facilities, private clinics will actually be given priority. The elderly above 50 years will also be given second priority after the health workers.
So
the numbers...
Sorry, apology, Dr. Usman. We have barely 3 to 5 minutes to run though. Is that okay?
Okay, so I will attempt to run through the remaining slides. Sorry about that. Now, implementation strategies for delivery of COVID vaccine, health workers, phase 1, older people, phase 2, persons with underlying medical conditions, phase 3, other target groups, phase 4. So the micro plans will actually be bottom up with collation of all information from the community ward levels. Is adapted based on countries' massive experience in conducting mass campaigns to a specific tailor need. Targeted persons in phase 1 will be pre-listed, documented to allow for proper scheduling, allocation of vaccines to follow up as part of the pharmacovigilance and safety monitoring. And therefore, there is a shift from the hand-drawn maps that we are used to GIS map with high-resolution pictures in the conduct of the macro planning. Frontline health workers, we have adopted the free and open source district health information system software DHIS2 as the national standard system for the capture of this data. Electronic pre-listing of all potential vaccine eligible candidates will be listed using the DHIS2. And there will be a link for every health worker to self-register, will be created on this DHIS2 platform without the normal complex login configurations. You just click on the link. That link will be shared across platforms of health workers and unions and hospitals and states and LGS to be able to register for all eligible candidates, vaccine recipients. Capacity building of the workforce will be done to deliver this COVID vaccine. 60,000 health workers providing routine immunization will be key in doing this. Supportive supervision is key component and will be conducted in 3 phases at all levels: pre-introduction, during introduction, and post-introduction. Very important for pharmacovigilance. The training will be implemented utilizing the cascade approach. The national training of trainers will be done virtually, and it will be domiciled in NPSCDA together with our partners and sister agencies to ensure safety. IPC will be fully implemented in line with NCDC guidelines. And therefore, the following assumptions have been taken. I've gone through this. And the risk communication strategies will be implemented across different phases of COVID-19. Arrival, vaccine safety, we engage experts, Nigerians on safety, sensitized stakeholders. Arrival and vaccination, we provide evidence of vaccine acceptance. We mobilize communities, create awareness through the various channels. We'll be trying to do this. 13th of January 2021 showed 3,900 mentions were actually related to COVID-19. So what am I saying? This is an evidence that at least people are sensitized about the coming of COVID-19 vaccines, and therefore we may not have any problem regarding our rollout for these COVID-19 vaccines. Now we have scheduled social media appearances which have been done in various media. Our ED has appeared, Minister has appeared, even myself I have appeared in one of the TV channels, try to actually allay the fears of individuals around the safety and efficacy of COVID-19 vaccines. And there were weekly slots in radio stations across the 6 political zones to float 15 minutes recorded weekly program on COVID-19. What am I saying? I'm just saying that there is massive sensitization to allay the fears of Nigerians around the safety and efficacy of the COVID-19. So this slide details what has been done so far regarding the voice notes, public service addresses, and short videos that are being circulated within various platforms to ensure that. So activity updates of the demand generation and risk communication subgroup. These are the updates that have been done. Conduct sensitization meetings. Plans are underway in the next couple of days, weeks, to engage other bodies, CSOs, which you are doing right now with this esteemed body, the Islamic Medical Association of Nigeria. So these are the special media appearances that has actually been done by the ED and other top officials of the MPSCDA and the ministry in the various media across Nigeria. And the engagements, meetings with stakeholders on COVID-19 vaccine rollout. Meetings were held with the media, meetings were held with agencies, boards, chief executive from the states, and meetings were held with religious leaders of the Christian faith. Meetings were held also virtually with the religious leaders from the Islamic faith. So arrival, in anticipation of arrival, supply division from UNICEF sent pre-alert 2 weeks before arrival of these vaccines and accompanying devices. The 100,000 that we are expecting will be airlifted to Abuja. Clearance will be done within 24 hours of arrival, and electronic vaccine arrival report will be sent to UNICEF supply division within 72 hours of arrival. And what do we need to do before receiving these vaccines? An appropriate area, discarding dry ice to eat. This is just outlining the vaccine handling that we need to do, safety goggles and so on. The equipments are available. The vaccine storage between -80 to -60 is available at the National Strategic Cold Store. We have shown this on the national media. Temperature monitoring will be done in the inbuilt with the inbuilt temperature monitoring device at the ultra cold chain. 3 units of this each, with the capacity of 678 liters in the National Strategic Cold Store. And very recently, we are deploying this equipment, one per geopolitical zone, for us to be able to handle this type of special vaccine. So this is just a photo slide detailing what this equipment looks like. Strict vaccine accountability and traceability will be deployed to ensure that every dose, every vial is fully accounted for. So our prayers to this esteemed body is sensitizing members of other Muslims within their constituency on the safety of these COVID vaccines, and then publicly taking these vaccines to exhibit their confidence on the safety and efficacy of these vaccines when it comes available, and active collaboration with us as an agency and other partners to ensure successful rollout. Mr. President, Royal Highnesses, esteemed members of Iman, I will stop here and happy to address some of your questions when it arises. Thank you, and over from my side.
يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن